Cold weather is something that affects us all during the winter period, with many direct and indirect impacts. Each season, we see an increase in illness and deaths across the winter months. Low temperatures can be particularly dangerous for vulnerable groups, as they cause respiratory and circulatory problems and also have an impact on mental health. These impacts may be greater this winter due to the additional risk of the COVID-19 pandemic. I'm Emer O'Connell, consultant in extreme events and health protection with Public Health England. It is important during these winter months that we take the necessary actions to support those who are most at risk from cold weather. In this edition of Health Matters, we'll be taking a look at the impact of cold weather and the health actions that can be taken to prevent harm, particularly to those who are most vulnerable.
I am concerned about cold weather because it has got direct and indirect impacts on people's health and well-being. Directly, it can affect people with high incidence of heart attacks, strokes, respiratory illness, flus, and even falls. And indirectly, it can affect people's mental well-being. It can lead to anxiety, depression, and if you lived in a cold and damp home, and if you're a young person, it can affect your education attainment.
So we know that respiratory disease is the leading cause of excess deaths in winter. It's estimated that it's 85% higher than at other times of year, and we see a huge amount more respiratory illness in winter. We have a very seasonal specialty, particularly for those admitted to hospital. There's a lot of different causes for the excess deaths in winter. In particular, up to 30% of them are due to people living in cold homes in fuel poverty. A fall of about a degree in temperature outside leads to a 5% increase in respiratory illnesses and a 3% increase in respiratory deaths.
Excess winter deaths, the difference between average daily deaths in winter months versus other months, occur throughout England. Across the winter of 2017 to 2018, there was a large peak with just over 50,000 excess winter deaths in England and Wales. And in 2018 to 2019, there were an estimated 23,200 deaths in England and Wales.
So more people die during winter, and we know that the direct effects of cold include increases in heart attack, stroke, but particularly in respiratory illnesses. The majority of these deaths are due to lung disease, to respiratory causes, but also heart disease and stroke can have a significant impact. You can't really tease out one particular target to try and improve that, however, because it's complicated. There's flu in the background, and cold temperatures and the wider determinants of health, including particularly poor housing, have a significant impact. After the cold snap, initially, you see increases in heart disease and stroke within the first week, but respiratory illness takes longer to rise, and that peaks around 12 days later. The impacts are seen, however, for a significant period, and in fact, excess deaths after a cold snap only return to baseline levels after 40 days. Surprisingly, you start to see the impacts from cold at fairly mild temperatures, about 4 to 8 degrees, but risk obviously increases as temperatures fall below that. Most excess deaths due to cold weather occur at what we would probably view as normal seasonal temperatures rather than at extremes. So the public health response has to consider both elements, what we do as an emergency when there's a seriously cold spell, but also what we do to prevent harm most of the rest of the time.
Vulnerable people, particularly those who are over 65 years of age, are at increased risk of harm from cold weather. This is partly because of an increased likelihood of suffering from pre-existing chronic illness as we age, which can be exacerbated by the cold, and partly because as we get older we experience a reduction in muscle and fat, which are important in retaining body heat.
As we age, our immune systems start to function less effectively, which leaves us more vulnerable to normal seasonal infections such as flu and colds and, of course, coronavirus. We also know that muscle mass decreases with age, which can make it harder for us to keep warm, and that it's more common for us to have those kinds of health conditions that exacerbate in the cold weather, particularly circulatory and respiratory conditions. Older people also tell us that they find it harder to manage in winter, that the colder, shorter days make it harder to get out and about, to stay active, to carry on doing the things that they usually do and to participate in their communities. Winter is often also an expensive time for many older people, and they can find it a struggle to heat their homes, and they do worry about the bills. There are around 1 million older people that live in fuel poverty, and we know that living in a cold home is one of those things which can be particularly dangerous if you have a health condition, for example, which makes you more vulnerable to the cold, but also all of those other things which we know make people more vulnerable in winter.
Another factor of cold weather illness is something much closer to home, our living accommodation. With more than 90% of our time spent indoors, the home environment is an important determinant of both physical and mental health.
So when the weather is cold, two of the factors that make people more vulnerable to the harmful effects of cold are if a person is sleeping rough and they're, exposed to the cold environment, or if they're living in a cold home. People tell us that living in a cold home is miserable and that it really affects their mental health and well-being as well as physical health conditions. And living in a cold home can come about because of fuel poverty, and that's based on three things. So that's if the property, the dwelling itself, isn't very energy efficient, and it relates to being on a low income and the cost of paying the fuel bill, energy prices.
Poor housing is a particular concern. We know that from a respiratory perspective, we see significant increases in lung disease in people who live in damp and cold surroundings. Asthma occurs more in children and adults in damp housing conditions.
There is support available in the form of benefits and grants for people who are living in cold homes or experiencing fuel poverty. And those benefits are to help pay the fuel bill, or to get a boiler repaired or replaced, or to install insulation, things like that. And we know that not everyone who's entitled to that support is accessing it.
So with all this in mind, what resources are available which we can use to prepare for the effects of cold weather in winter? Public Health England, in conjunction with NHS England, Local Government Association and the Met Office, delivers the Cold Weather Plan for England, which sets out the actions to take throughout the year to prevent cold-related harms to health, whatever your role is, in local government, emergency planning, health or care services, or the community and voluntary sector. As we approach winter, now is a good time to sign up to the Cold Weather Alert System, to familiarise yourself with the Cold Weather Plan for England, and to consider the actions you need to take before, during and after a cold spell. This year, there are some additional considerations due to COVID-19.
Older people and people with long-term conditions and who are mostly vulnerable are more at risk. And they're the same group of people who are at risk from COVID as well. Because we are in a high alert area and we have got restrictions. People have to socially distance and they don't have carers or health professionals visiting them as they would normally have. So they may not be able to tell anyone if they're living in a damp environment or if they need help, or they may not be aware that they can access grants to help them towards their fuel costs.
One thing that's particularly concerning for this winter is that increasingly we're using digital media to deliver healthcare, remote consultations and remote delivery of other things like pulmonary rehab in particular. And that excludes those who are already in those vulnerable groups that I've mentioned. The elderly and the homeless in particular tend to have less access to digital resources.
Checking in on older people in your family, your friends, your neighbours and in your community can all make a very big difference indeed, whether that's online, by phone or in person if it's safe to do so in your area. Or if not, perhaps even consider sending a letter just so somebody knows that you're thinking of them. Making sure that people stay safe and connected is going to be very important.
Local authorities, NHS commissioners and partner organisations, including health and social care services, should consider the Cold Weather Plan for England and satisfy themselves that measures are in place to prepare for and to respond to cold weather this winter. While it's still mild, it's a good idea to sign up for the cold weather alerts. These will notify you when cold weather is on its way. People who are vulnerable to cold weather may also be vulnerable to COVID-19 due to the intersection of clinical and socioeconomic factors. Whether you're a GP, a public health lead or a concerned neighbour, It's important to proactively identify those at greatest risk, to ask them whether they're living in a cold home, and to support them to identify the help that is available to heat their homes. So the action set out in the cold weather plan should continue this year as normal, but you may need to do things a little differently. To support you to do this, a supplementary side deck has been published and may be considered alongside any additional restrictions that may be in place locally.
Cold weather planning starts right at the beginning of the year. It's an all-year-round planning, and it's a multi-agency planning. All local authorities and with the healthcare centre, we plan for winter. So this year, it's even more important because of COVID. So we have been planning, especially with immunising with the flu vaccination. So this year, more than ever, we are making sure people who are vulnerable, because they're the same at-risk group people as COVID, that they're covered for their flu immunisation. So we've been promoting that widely. We're also raising awareness what the harm that cold weather can do to you. So not just with people who are living on their own, but also with care home staff. So we just need to be mindful. It's a multi-agency approach to protect our residents.
There are three main things that I would say are effective actions. One is to identify the people who are most at risk of ill health over the winter, and that could relate partly to COVID and also to the cold weather and cold homes. The second thing is about helping people who are not in appropriate accommodation to move into a stable and secure and suitable home. And the third thing is about fixing problems with existing homes. So getting the boiler replaced if it's broken, installing insulation, getting rid of damp, sorting out those problems that affect people's health.
Given the impact that housing conditions can have in general on lung health, in Gloucestershire we've started working with the CCG, housing providers and the County Council to explore how we can influence housing standards and fuel poverty. And that needs coordination across health, social care and local authorities to try and address such a multifactorial problem. We're also trying to get the message out across the whole community to encourage people with respiratory long-term conditions to attend to their health in winter. We're trying to get publicity into primary care, public health communications, social media, in pharmacies, and potentially including information about lung health in the winter in relevant medicines when they're dispensed.
Perhaps we could all get more creative about how we support each other and older people in our communities to stay active and participating in the things that they enjoy. That could be as simple as helping somebody get online so that they can carry on participating in their community groups and clubs. Making sure that people have everything that they need is also essential, and it's a very simple thing to do. So do people need any help with shopping? Do they need help picking up their medications? Do they have any errands that you could run to ensure that they have everything they need at home to stay safe and well? Last but certainly not least, encourage and support older people to access medical care if they need it. Keep an eye out for any signs of deteriorating health, and certainly never be afraid to ask for support if you think that somebody's health is in danger.
The winter season is always a difficult time for our frontline services. This year in particular, with COVID-19 and the restrictions put in place to contain the virus, it's going to be even more challenging. As we've learned throughout this edition of Health Matters, there's no one solution. The cold weather plan sets out the guidance and good practice recommendations we need, but preventing these harms requires a coordinated response and multi-agency planning, with health and social care, local authorities and communities all acting together. This includes making sure as many people as possible get their flu vaccine, with a particular focus on the elderly and vulnerable. All of the information in this video can be found in more detail through a written edition of Health Matters, which you can view by visiting the URL on screen. I'm Emer O'Connell. Many thanks for watching.